In this first edition of Network News Now, you'll hear from an energetic group of network support team members reporting live from coast to coast. Matt Bond, Stacy Chazen, Grace Lynn, Fatima Morales-Clark, Kate Schechter, and Francis Walsh. But first, your network in 90 seconds. Milestone Mania, a network-wide project, is underway, and state and grassroots reps are on the move to collect data on the network's 7 milestones. Stacy Chazen reports on what you can expect and why it matters. An identity discovered. A response team has been hard at work imagining a brand for the network, including a new name and logo. You'll hear from Grace Lynn about the hot-off-the-presses new brand platform that network members helped create. And Francis Walsh will tell us more that's in store for network materials as the network brand unfolds. Progress towards independence. It isn't 1776, but the network is at no less a momentous point in time. As with any move towards autonomy, there are lots of efforts underway to make this network its very own operation. Kate Schechter will give us an update. And finally, network happenings. You don't want to miss the network's upcoming in-person events, so make sure they are on your calendar. Our own Fatima Morales-Clark will tell us more.
Hello, Oral Health 2020 network members. Welcome to Network News Now. My name is Matt Bond, and I'll be your anchor this evening. We'll start with some news out of New Jersey. I'm going to introduce Stacy Chazen from the network support team to tell us what's going on with the Measurement Milestone project. Stacy, out to you.
Thanks, Matt, and hi everyone. This is Stacy Chazen, and I'm happy to be coming to you today from my home office in beautiful southern New Jersey. I'm happy to give an update on the 2018 network-wide project. There's been a lot of buzz about this project already, and a lot of great work already done by our ever-committed and passionate group of network members. More than 50 network members volunteered to serve on one or more target teams that met throughout the month of July to identify what questions we need to answer in each state and across the country so that we can figure out how we're measuring up against 36 milestones that the network had identified for achievement by 2018. Seeing our progress against these milestones is going to allow us to celebrate our accomplishments, see how much further we have to go as a network, and also figure out if we need to make any course corrections in the next 2 years to be able to reach all of our OH 2020 goals and targets by the year 2020. The target teams also recommended data sources for each measurement question, crafted some guidance for state and grassroots reps who are going to be collecting the data, and captured all of their recommendations in data templates that were shared with state and grassroots reps earlier this month. Since then, reps in every state, as well as national organizations that are members of the network, have been reaching out to stakeholders who they know have access to the data we're looking for, and figuring out how to measure the milestones we don't already have data for, and coming to us with thoughtful questions. All of this great work is building toward completion of all states' data templates by September 14th. We have been so impressed with the hard work the state and grassroots reps have already put in, the innovative solutions they've come up with, and the really thoughtful questions they've raised that are going to make this project happen. I'd like to also give a shout out to the 12 Regional Oral Health Connection Team leads that have been supporting the reps in their work, the Stewardship and Learning Workgroup, which it has provided overall guidance for the project, and of course members of the network who've been responding wholeheartedly to any requests for data that have come their way. We couldn't do any of this without all of you. And we look forward to sharing all of our wonderful findings, and even the findings that suggest that we might have some meaningful strides that we still need to hit between now and 2020 so that we can figure out as a network how we can be successful together between now and then. Thanks, everyone. Back to you, Matt.
That sounds like really great stuff, Stacy. And now we'll go out to Colorado and check in with Grace Lynn, who's been working on the network branding story. Grace, out to you.
Hi, Matt. It's a great day here in Colorado. A little bit of fall here in the air at 8,500 feet above sea level. I'm excited to report that the branding network response team has been very busy working with the Lippincott Agency to develop a brand platform and name for our network. Thanks to everyone who voted on the network name. The 3 finalists, if you remember, were All In, Open, the Oral Health Progress and Equity Network, and Momentous. The big reveal will happen at the annual meeting here in Colorado in October, and the excitement is definitely building. I mentioned a brand platform, and that's equally as exciting. The platform is our network's identity statement and will be used by members to build connections with our stakeholders and members. So what's in a brand platform, you may ask? Well, it has a purpose statement, commitments, and design principles that tell the story of why we do, what we promise to deliver, and how we feel. And the extra cool part is that there is alignment happening with the messaging network response team to make sure that our framing, values, and metaphors are working together with the new brand platform. Rest assured that there is a group of members leading the next parts of the branding process, developing a logo and visual toolkit. That's it for the update on the network branding, Matt. Back to you in Boston.
Wow, Grace, that sounds like really important work. And I don't know about you, but I can't wait to get rid of this orange. I do have a question though. What's going to happen to Socius and all the materials the network has been producing? Well, for more on that, let's check in with Frances Walsh out in Montana. Frances, out to you.
Greetings from the forest, a complex network of trees, soil, rocks, and lichen, all working together to make a stronger whole. The NOCT Communications and Messaging Workgroup is also working hard to strengthen our network by reviewing all network material, editing for consistent values and content, and ensuring that we stay on frame in our messaging. We'll have these materials ready with the brand launch, so get ready for our unified messaging efforts to take root and watch this movement reach new heights.
Thanks, Frances. Wow, so new brand, new materials, new Socius, new look and feel. What else could possibly be going on? For more on that, let's check in with Kate Schechter in Maryland. Kate?
Kate here, checking in from the Chesapeake. I'm excited to report that the Sustainability Workgroup has been no slouch either these past few months. The Workgroup held a meeting to flesh out the definition, purpose, structure, and capacity of the independent organization. With support and participation from the DeneQuest Foundation and Nest, 10 workgroup members from across the Grassblades and from across the nation met for 2 days in Boston in April 2018. Workgroup members designed the agenda and facilitated the meeting with input and content management from IASC. They weighed the pros and cons of various funding structures, created a SWOT analyses, refined the independent organization's purpose, and outlined next steps. And I have to say, Matt, the future is looking bright. As planned currently, the new organization will support the network in a variety of ways, including meeting design and facilitation, management of Socius, leadership of shared learning, and more. DeneQuest Foundation will not be the sole funder of the independent organization. DeneQuest Foundation and network members will actively seek out other funders with complementary priorities to also support the independent organization and the Oral Health 2020 network. Transparency will be maintained throughout the entire process, so we're going to check back in with more very soon. But with that, the Sustainability Workgroup has said that they've heard a lot of why now, and we actually have you, Matt Bond, quoted as saying, "We've outgrown our womb, and now it's time to emerge into a brand new world." With that, Matt, back to you.
Well, truth be told, Kate, I'm not really sure I recall saying that precisely. But I will say, is there any better time than right now? So that'll do it for today, folks. On our way out, we want to send you off to our friendly face Fatima, who's going to share some upcoming events with you that you need to know about. We look forward to seeing you at these events in the future, and thanks for tuning in for our first episode of Network News Now. Fatima, take us home.
This is Fatima reporting from Los Angeles. I'm here to share 2 exciting events that are coming up within the network.
First is our OH 2020 Public Policy Convening happening in Arlington, Virginia, September 13th to 14th. We're hoping you'll join us. The second exciting convening that's coming up for us is our national meeting, which is taking place in October in Denver, Colorado. This is our time to get together, connect, strategize, prepare for the next year. And this year we have a lot of exciting updates to share: a new brand name, a new brand, a new name, and all the progress that we've done over the past few years. So we'll hope you join us. More information is available at www.oralhealth.network.
We appreciate you spending some time with us today. That's it for this edition of Network News Now. Thank you for watching.